sanction check is a tool that we use, or that our clients use, in order to mitigate the risk to their company by finding the sanctions like the ones that we're going to discuss today. But sanction check is just that. It's a tool to help you make decisions. So any hiring or termination decisions are that of your legal or HR department. So sanction check alone should not be the deciding factor on whether you hire or terminate anyone in your employ. So we're going to throw it over to Will. He's going to tell us our second horror story today about Dr. Peter Choy.
Yes, so Dr. Peter Choy, now well, at least the first of the offenses that came up were in New York State.
Okay.
He was working there, and there were four professional misconduct charges that came up. Basically, in all of them, he was misrepresenting himself. Okay, so there's a span lapse between 2000, when we have this issue, to 2012, when the main issue involving this physician comes up. Basically, he had a patient he was treating. He was her primary care physician, and he ordered a CT scan on her. Now, the CT scan came back and showed a very large mass on the tail end of her pancreas. But
and when was this? 2008.
This was in 2008.
Gotcha.
So, but I'm mentioning this is the sanction that came up for 2012. Again, it's a lapse sort of
Gotcha.
between when it happened and when the sanction came up. But so eventually his patient dies in 2010.
From that.
Yes, exactly.
Pancreatic.
Yes, most likely.
Mass.
Yes. And it happened only 1 month after she learned about this, when it was discovered. Now, that means that there was 2 whole years when she could have learned about it.
Been treated appropriately.
Right. There was this mass on her pancreas, and he never said anything to her. So she died, and that is when her son made a complaint to the Florida Board of Medicine. And the Florida Board conducted an investigation, and they did find that that something else had happened. And so basically, once that investigation started, Dr. Choy panicked, and he manipulated his records. He actually changed them to say that he had notified the patient of the mass, and he had asked her to be treated by a specialist, but apparently she had declined. And during the investigation, it came out that Dr. Choy had altered his records to...
So none of that stuff happened.
Right, none of that happened. So he's making it look like he's safe and that he did what he was required of him, but that's not what happened. And they were able to verify that. And he was charged with manipulating this documentation. So as a result, he had his license suspended for 6 months, followed by 5 years of probation, fined $35,000, required to complete lots of training, and be supervised by a board-approved physician.
What's going on now with him?
So, well, he's still practicing. So, I mean,
currently.
Yes. So, I mean, we have every reason to believe that he has, let's say, reformed.
Yeah, I mean, we'll give credit where credit is due, right? Like
Yeah, so he completed what was required. He completed his probation.
Right. Paid his fine.
Yeah.
Did his classes.
Yeah. But still, there's just this history of falsification that follows him ever since the first one in
New York.
Yes.
Yeah.
And so there are a lot of concerns about that I think are valid, but that's just my opinion.
So let's take a look at his sanctions. So when we take a look at Dr. Choy's sanctions, as you can see, he has not been federally sanctioned.
Mm-hmm.
Right. So just like we were discussing earlier when you started the story, if federal sanctions were all you were looking for in Florida. Let's say I'm hiring him in Florida, and I do a sanction check or an exclusionary screening, and I look him up, but the only databases I'm searching are federal ones.
This wouldn't come
This
up.
wouldn't have, you wouldn't have seen him at all.
Right.
No.
Right? Or if you're only looking for, let's say he's trying to get a license in South Carolina, and South Carolina only searches South Carolina in federal databases, he wouldn't have shown up. So I think it's a lesson in making sure that you're doing your due diligence, checking to see where else they've held licenses, and making sure that you're mitigating that risk.
Exactly. And I think this is the scariest thing of all, is that he's still out there practicing. And even though he has reformed, hopefully, you still have to wonder for the person for that lady who died without knowing that she had a mass in her pancreas. That was everything. That was everything. That
was
was
her
very
life.
scary. It was her life. And, one life is everything.